It's a real pleasure to be invited along today to talk about delivering harm reduction in a community hub setting. Seems really basic, but for us we feel it's a really important thing to say. My name's Graeme, I'm the Policy and Public Affairs Lead for WithYou in Scotland, so I can take zero credit for delivering this service, but I've been the person nominated to speak on behalf of the team here in Dundee. And so it's really just to say thank you to WithYou in Dundee who deliver this service, in particular Bobby, Nikki and Ricky. Nikki and Ricky, geez, who've been delivering this service for quite considerable time. Which one's the big green one? There we go. So, as mentioned before, I'm here to share our experience, essentially, of delivering harm reduction in a community setting, but I'll kind of run through a wee bit of history about WithYou in Scotland. I won't bore you, I've been here for 20 years, so I won't take 20 years in telling you all about it. Bit of context in terms of what we do in Dundee, and then I'll sort of delve into actually what it is we do in our community hub. So WithYou in Scotland, we've been delivering services for 20 years. We formerly known as Add Action. So we have been delivering these types of services for quite a while. And for those that don't know us, we're a drug and alcohol charity, do a little bit of mental health support as well. And each year we help over 14,000 people. And this is based primarily delivering evidence-based interventions to reduce alcohol and drug-related harm in Scotland. So this is a wee summary of what we do. We do frontline community services, drug and alcohol. We deliver harm reduction, IEP, assertive outreach, residential rehab pathways, bit of young people support, bit of family support as well thrown into the mix. We also deliver community link services, which is primarily based in GP practices, delivering sort of social prescribing, links to wider community supports. And lastly, we do also provide digital services. We do have a national web chat service where you can speak to a real person, and it is a real person, by the way, not a chat bot. And we also deliver the Know the Score website and Drinking helpline as well. So, WithYou in Dundee. So, we've been in Dundee for many years, and the team up the back can tell you exactly how many years we've been in Dundee, but primarily we've always had a presence in the city. Before, we've always delivered advice and information around drug harms in the city. But over the last few years, this has developed into a wider support services. Essentially, in terms of how we work, right? Our service in Dundee, like all of our services right across Scotland, is about working with people alongside them to achieve their goals, whether that's about harm reduction, abstinence, recovery, whatever, we don't care. What matters to us is the person in front of us and how we work alongside them. So in terms of Dundee, we provide a couple of things. We provide one-to-one support, structured interventions. We deliver brief interventions through group work. We deliver our Pathways to Recovery, which is our rehab support service. And we also provide concerned and other support, family support, to give it another word. Today is really about talking about harm reduction in a community hub. For those familiar with Dundee, our service is conveniently based in a very well-known branded pharmacy, which I've blanked out there for copyright reasons. So for us, actually, it's really been very important. We feel very fortunate to be placed in a pharmacy. Over the years, I've heard so many bits of feedback about the stigma that people face as they try to access prescriptions, ORT within the pharmacy. How lucky are we to be in there to try and combat some of that? In terms of the history, right, this is not a new idea, a community hub. I'm not going to take credit for saying, we created the hub, because we didn't, the idea of a community hub. But it has been on the go for a long time. So 2014, we got some money that after a review in Dundee saying, look, do you know what? We need more community-based interventions. So we were able to get some money, created the hub in partnership with the pharmacy. A year later, we managed to recruit an actual worker, which always helps. And over the subsequent 4 or 5 years, we delivered harm reduction interventions. However, in the backdrop of all of that, there was a cost of living, there was austerity, there was changing national policy. And what we were finding is that actually that was starting to adapt and shift away from what we wanted the hub to be in its first instance, which was around harm reduction. So what we found was access to food vouchers and welfare rights, really important, but we're drug and alcohol workers, so we found we were getting pulled in different directions. So I'll tell you a little bit about what the hub is, right? As I've mentioned before, it's conveniently located in a pharmacy, right? Which is so brilliant. People are up picking up their prescriptions for ORT. Sometimes they're in there getting prescriptions for other reasons. But where we're based is in Albert Street in the east end of the city, right? It's a really busy location. But what we've managed to do is create a safe and friendly space for people just to come in, have a conversation with us. And the most important thing for us is being able to talk about alcohol and drugs. Right, it's really important. Access to those wider things are dead important too, but people want to talk about the things that they're using, and I think that's a really important thing to say. And the other thing as well is to talk about being flexible, right? People can just drop in, say hello, have a chat, not have a chat, get a leaflet, get whatever it is they need, and I think it's all about really, that's really important to us about that flexibility. And lastly, I just want to highlight that collaboration with the pharmacy, right? We couldn't do this in isolation, right? Today is all about joint working, isn't it, in collaboration. The pharmacy team at that well-known pharmacy in Albert Street are excellent. The collaboration that they've been so involved, they join our team meetings. We've been doing sort of shadowing sessions with them. They're really brilliant. They help us, we help them. That's what kind of makes it work, essentially. So what does it offer, right? It's 3 things that we offer, right? Doesn't sound like a lot, but at its core is psychosocial and harm reduction interventions, right? So people can get access to naloxone, they can get dry blood spot testing, they can talk about overdose awareness, they can get interventions around reducing harm to any substance, right? And whether it's cocaine, benzos, cannabis, whatever. And what is really important for us is the second phase is around, it's an access point, right? People are familiar with that well-known pharmacy. They can come in, and for them, it means that they can start to access MAT standard type treatment, right? Access to wider support. Or most importantly for us, is access to our other service. We've got a recovery service. We've got a service that provides access to rehab. So that's the access point for people, and we really like that. And then the third thing is about creating a community space and bringing in those resources, welfare rights, food banks, employability, nursing support. That's really important that we've managed to, that's what we're trying to create, sorry. Before I talk about what's new, I think it's really sort of important to understand why, right? Harm reduction and hubs are not new ideas, but what we realised is that the need was changing in Dundee, like it has done right across Scotland. Drug deaths rising. There was a drugs commission here saying access to services was difficult. Deprivation is a problem. It cuts through all of our drug death stats, all of our alcohol-related harm stats as well. Within that time, the national mission appears as well. We must focus on the drug-related deaths. And alongside that as well as drug trends. Cocaine is not just an issue this year, it's been like this for 5-6 years prior to this. Benzo use, let's just talk about benzos. That's been what's been killing a lot of people, let's be honest with it, and polydrug use too. And what we realised is that the service that we were providing before wasn't necessarily meeting the needs of the people that we were trying to access. So, this is what we did. We decided to revamp, review everything that we wanted to provide. So making sure that under the one hub, the one building, that we provided all of these things. Psychosocial intervention, naloxone, overdose awareness, access to MAT, residential rehab access, bringing in health inclusion, nursing, team, employability, welfare rights, all of that under one banner. And I think that that's really what we did in terms of a review to improve the service that we were providing. So what makes this better? Does it make it better? That's always the kind of key thing, isn't it? So what we found and what the team were telling us, what stakeholders were telling us, is that the previous practice was starting to focus on things that probably could be provided by other people. Like, we are no experts in employability, we're no experts in housing. So what we found, we were getting pulled into those areas. So what we wanted to do was to renew and reinvigorate and focus on harm reduction and providing those key interventions around drugs and alcohol. So that improved practice is now meeting the needs of the clients who kick around that area of Dundee. We're also reintroducing structured group work. So it's not just a case of you get your naloxone or your clean needles. It's very much about you get access to a wider support, structured group work, MAP groups, whatever. And also that refreshed drop-in service is now engaging people who are most at risk, and I think that's really important to highlight. We've also managed to pull in a wee bit of extra money to do the safer scheme, which is a sort of harm reduction sort of scheme that sort of rewards people to engage with harm reduction, if that makes sense. I've probably not explained that the best way, but ask me after this. Further improvements. We also found that the hub was isolated, right? I know we're right in the middle of the city or east of the city, but it was isolated from services. It was isolated from our own service. But through this review, we now feel that everything's a bit more integrated. So if they come to the hub on Albert Street, it means that they can get quick and easy access to rehab potentially through our own service. Also, the perceptions and engagement with local services improved. What I didn't mention was COVID was in that period as well. Remember COVID 2020? Remember that time? All the services stopped coming to the hub because everyone changed their practice. But since the review, we've now seen those services and others return, which is really good. And most importantly, our NHS treatment service is now far more closely aligned to the work that we're doing. And sort of lastly here is about the hub wasn't really a welcoming space before, right? It was just some rooms and a bit of an add-on, but we managed to get some additional money, and we've now really created a very warm and welcoming space. And as my colleague Nikki had reminded us, the hub isn't even ours, it's the clients who use it, it's their space, but we wanted to assist them by providing at least somewhere nice to come and hang out for a bit. So what difference is it making? And this is always kind of critical, isn't it? So we've seen an increase in referrals, which is good, into our own service and people coming through the door. Our harm reduction kits is the stuff that we give out, naloxone, IEP, all of that. Our brief interventions around alcohol and drugs have increased greatly over that period of time. 70 referrals for MAT, that's no like to get a MAT, it's to referrals to the local treatment service. But overall what this has led to is increased engagement for the people and improved collaboration with the services in and round about us. This is what one of our clients say. I'm not going to read it out. Obviously, they say we're brilliant. I agree with them, absolutely. And the team hear this type of thing a lot. Listen, today, what I've been struck with today is sometimes it's the simple things, isn't it, that make the biggest difference. We're just providing space and focusing on the things that we know what to do and we do it well. The staff have also had a little bit of an impact, which I think is really important. We've seen development of their skills improve. Their work practices have been more focused, so they're enjoying their job a bit more. There's increased joint working, the links in terms of near fatal overdose pathways, awareness sessions by talking to the police around drug awareness has improved. There's been an increased recognition of the work that we're doing, and I think that's really important. And also as well, I mean, they even get invited to speak to Parliament. Who would like to do that? No me. And also as well, we recently met up with a local journalist, and I don't know if anyone is from Dundee in here. Sometimes media coverage is not always the most positive, but what was really important about that is the team in the hub were able to talk to the journalist about what's meaningful in terms of language and actually cover it a wee bit more sensitively. Can't even speak today. So what's our learning? And harm reduction increases engagement, right? It does, it's simple, but it works. It improves access to support. If you've got somewhere that people feel safe, and comfortable coming to, it will improve access to MAT standards and things like that. Having it in the community removes barriers. Again, not rocket science, but that's definitely what happens. And having a hub provides the opportunity for greater collaboration. And overall, it increases awareness and knowledge about drugs, alcohol, joint working, about what all of our services do. So to summarise, the review and the changes we made has made a huge difference to not just the people of Dundee, but also the team providing the service and support. So I have managed to come in bang on time, Louise. So thank you so much for listening. There's my email if you want to get in touch.